Some say we live in an age of anxiety. So many things that cause stress and worry, particularly with our young people. And it's not just social media, although of course Meta, Facebook, has nurtured this, so does TikTok, as we feed anxiety, the compare and despair syndromes that trap so many young people. But with older people too, we see great worries about their futures. How will Social Security and Medicare survive? Who's going to take care of them? Will there be enough caregivers? Will Medicare be able to pay the bills? What's going to happen to my savings? These worries seem to torment our seniors. Maggie, do you think we live in that kind of age of anxiety, or is it overblown by the media?
I think the answer could be both. I think the media likes to talk about anxiety, and I think that, people are drawn to that topic. I think there are two things, though. I think people are definitely wrestling in modern life with a lack of community, and we know that community buffers a lot of anxiety in people. And I do think technology has an impact. We know that smartphones are 100% creating more anxiety in children. So that's definitely real. And if you're watching the news all the time, and many people are, how could you not feel a little bit of anxiety? Because there's nothing good on it,
And that's been that way. Even though everyone knows that the news is going to be a parade of horribles, they still tune in. Why is that?
I think it's compulsive. As I've said in some of the other things, stimulation is stimulation. And I think if you're not being stimulated by the good stuff, and many people are isolated, and again, coming back to community and things like that, they're going to seek stimulation in the bad stuff.
But yet you look at church attendance and it's down, and all over, in all religions, all denominations, all over the world, even in America now. Presbyterians and Protestants and others, their church rates are cut considerably in the last 25 years. Catholics the same. You'd think that would be a place to go to have your hope battery recharged, and yet nobody's going.
No. And, I'm not sure what that is. I don't know, is it that there's so much virtual community now? People are getting those social needs met, from their tablets and their devices and things like this. I don't know if it's that they have maybe lost faith in some of those systems, with the scandals and things like that. Or does some of that for the younger generation just seem kind of passé, or it hasn't been handed down effectively? I'm not sure. It could be a mixture of all of them.
Yeah. And of course, last year, the highest number of suicides ever in America, and nearly 2 million attempts at suicide. What's going on beneath these numbers, the opioid addiction, the other staggering levels that seem to paint out a picture of despair? What do you think's going on that's causing all this?
Yeah, I think that's a lot of things. I mean, I don't think we could minimize the effect that COVID has had on people. That's one.
Just the fearfulness that it engendered and the worries and...
Yeah, and the isolation and the lack of control, I think, was a big one for people too. It did affect the social fabric. And, the thing that bothered me about it as a therapist was you'd work so hard with someone on their mental health issues, and then COVID came along, and immediately they lost all their positive coping mechanisms. They were all taken away from them.
Right.
That was very frustrating,
Yeah, and harmful.
And harmful. It was damaging. So I think a lot of people didn't come back from that.
I think you're right. I've seen that. I think the death-by-death coverage of COVID at the beginning, the sensationalistic coverage that led to a lot of political partisan purposes being met, but at the expense of the regular people who were affected by the fear-mongering. I saw dementia patients that had all their routines destroyed, and then people coming at them with masks where they couldn't recognize anyone. If you couldn't destabilize someone more if you tried.
Exactly. And that was really hard to witness. And what was also hard about that too, I found as well, was, I felt angry about it. I felt angry and I felt frustrated, and it was kind of like, where did you go with that?
So what do we do now?
Now, I think we get back to pouring our energy into our communities, working on recovery, working on our own mental health, what keeps you feeling healthy, what keeps you well. And I think we are still recovering, and I don't think people are talking about that enough.
And the relationship building that's needed to help us have a strong foundation to deal with life's ups and downs.
Yeah, absolutely.
Yeah, and I'm hoping that gets rekindled and in an awareness that we were damaged. I think first to fix it, you got to acknowledge it. And I think we haven't really even acknowledged all this damage.
Yeah.
If you only measure COVID by the deaths, and it was terrible, 1.1 million deaths. Some can claim that number is inflated, but the point is it was a devastating public health event.
Devastating.
But hopefully, people are waking up to this challenge while there's time to change it.
Fingers crossed.